Thank you very much for inviting me here and also for making an effort to stay until at this time of the day at the end of the conference. Very much appreciate it. I'm not going to present any particular study, but rather I want to take you through a journey of where we are in terms of understanding about the linkages between agriculture and nutrition, and give you a state of evidence of where we are again and what are we learning from the various studies and impact evaluations, and leave you with some thoughts. So I'm a nutritionist. Given that it is an interdisciplinary conference, I just want to tell you that I'm a nutritionist. I work mostly on public health nutrition issues, mostly in Africa and South Asia. And I also have a minor in development economics from many years ago, and I have worked with lots of economists all my professional lives, along with sociologists and anthropologists. So you will see that a lot of those things come into play as we try and understand, why the linkages between agriculture, food systems, and nutrition outcomes. We haven't talked much about nutrition. There was some, people alluded to NCDs and nutrition-related chronic diseases. But I thought, given that one of the tenets of conducting interdisciplinary research is to make sure that we are all on the same page about some of the basic concepts. Otherwise, we all might think we are talking about the same thing and perhaps not. So what is malnutrition? It's fairly straightforward. It is bad nutrition. And there are broadly two kinds of malnutrition, which is either overnutrition or undernutrition. And undernutrition, there is, again, two types of undernutrition, which is protein energy malnutrition and micronutrient deficiencies. And together we refer to them as undernutrition, and they contribute undernutrition contributes to 45% of around child deaths, child undernutrition. So it's a massive problem in terms of contribution to child survival per se. And overnutrition, sometimes we lazily call it overnutrition, which is a term I try to tell my students not to use because it's still malnutrition, and I think the more appropriate term is nutrition-related chronic conditions or diseases, which includes overweight and obesity. And in protein energy malnutrition, there are again two types. One is chronic, and the other is acute. The chronic undernutrition results because of sustained insults to a child and sustained deprivation over a period of time, and we usually call it stunting. So when there is chronic undernutrition, a child, the indication is that the child is stunted. Which means basically linear growth faltering, and it is indicated by low height for age. And this is something you hear quite a lot, the statistics quoted, the stunting rates in low and middle income countries. And acute malnutrition is wasting or acute weight loss because of seasonality related issues, because of infection related issues, and the indicator for this is low weight for height. So, and just to know what it looks like, on this side is a normal child with a normal weight for height, and the child wasted clearly is this child who has the same height as the normal child but is thinner. So it's the thinness. Whereas the stunted child is shorter than the normal child, but is not necessarily thin. So if you don't really know what the normal child should look like, what the standard should look like, they look fine. There are several photos, but since it's not a nutrition class, I'm not going to go into any further detail than that. And then the most unfortunate condition would be children who are wasted and stunted, and by no means is this uncommon. So with that basic understanding, I'd like to say that, we have massive burden of malnutrition, undernutrition. And although I think in the last, as these statistics indicate, between 2000 and 2016, we have seen some declines, about 30% decline in child stunting prevalence rates. However, these averages, global averages, mask some of the more disturbing trends. If you look at Eastern and Southern Africa and Western and Central Asia, what you will see is that actually the number of stunted children have either remained the same or increased, especially in Western and Central Africa. This could be because of famine conditions, conflict, population increase per se as well, right? These countries are experiencing extremely high fertility rates. And so there is, so yes, we have made a lot of progress, and I think overall I think we should take comfort in it, but it's really not the time to take the foot off the pedal. And we still have high geographic inequities. If you look at this graph, 34 countries account for about 90% of the global burden of undernutrition, and most of them are in South Asia and Africa. And there is still a persistence of high socioeconomic inequities. And this graph really shows the blue dots show the lowest wealth quintile, and the orange dots show the highest wealthy quintile. And clearly, as expected, there is an economic gradient in terms of stunting prevalence rates. But what this graph also shows is, if you look at the red line, even if among the highest income quintiles in these countries, the prevalence rates of stunting are pretty high. Over 20%, more than 1 in 5 children are stunted even among the highest income quintile, right? That's quite disappointing and shocking. And again, there is rural-urban inequities tend to persist. Again, this one, the blue dots are the urban, and on the orange dots are the rural. And what you find again here is that even in urban areas, while we conventionally think that the prevalence rates are relatively low, and that is true for the most part, but even in urban areas, the stunting rates still remain high. And in several of these countries, 1 in 5 children still remain stunted. Why should we care? We need to care because as the world is getting more and more urbanized, we will need tools and an understanding of the etiology of undernutrition even in urban areas, and how to deal with stunting both in urban and rural areas. The causes and consequences of maternal and child undernutrition cut across sectors and disciplines. In early 1990s, UNICEF has put forth a seminal framework to help us understand the determinants of maternal and child undernutrition. Basically, at the bottom is you look at the societal causes of how a society is organized, which is called the basic determinants of undernutrition. And in the middle, which is the blue boxes, are the underlying causes, which are more at the community and the household level, conceptually speaking. And the green boxes at the top are about individual level health status and dietary intakes together determine maternal and child undernutrition. And the consequences of maternal and child undernutrition can last generations. As we'd already talked about survival, but also there are clear wage gaps even as an adult, and a stunted child is more likely to be facing and suffering from chronic diseases in their adulthood. So clearly, we need to tackle undernutrition to be able to tackle nutrition-related chronic diseases as well in these countries. Now, in the common parlance, since 2013, there is new jargon in the world, and those are nutrition-specific and nutrition-sensitive, and hence the title for my job as well. And what we are referring to now in the nutrition world is the nutrition-specific interventions are the interventions that tackle the immediate determinants of undernutrition, which is mostly dietary intake and health condition of an individual. And nutrition-sensitive interventions are the interventions that really look at the underlying determinants of undernutrition, which means the interventions that other sectors implement in order to tackle undernutrition or any kind of nutrition related problem. Now, there are a set of nutrition-specific interventions. There is really no need to pay attention too much to this detail. There is an agreed set of evidence-based 10 nutrition-specific interventions of how the child should be fed, how the child should be taken to a referral center when when they suffer from severe acute malnutrition, various supplementation interventions, so on and so forth. But the issue so there is an understanding of what to do. But the issue we have is that we have very poor coverage of these nutrition-specific interventions. For example, if you really look at the minimum dietary diversity, MDD, which is basically consumption of 4 food groups out of 7 recommended food groups in the last 24 hours, just a quarter of children in the world, in low and middle income countries that were included in this in the statistics, consume a minimum diverse diet, and about 15% of them have minimum acceptable diet. So really, there is a long journey still ahead of us. So to take that further, the Lancet series on maternal and child undernutrition in 2013 really shows us that scaling up those 10 nutrition-specific interventions, that is the interventions that relate to eating and healthcare, by increasing them to 90% coverage would reduce stunting by 20%. Now, for every nutritionist in the world, that's a really disappointing news, right? We are at 15 to 25% on several of these interventions. Suddenly, they say that, even if you increase it to 90, the burden would reduce just by 20%. So then I think the question is, okay, what else do we need to do? And since there is a lot of appreciation of the role of other sectors in terms of contributing to tackling or accelerating reductions in undernutrition. So what else do we do, right? Income growth improves nutrition. There are quite a lot of studies, and I've just put a couple of them here, that show that income is a necessary but not sufficient condition. What this graph shows on the x-axis is the GDP per capita, and on the y-axis is the stunting prevalence rate of preschoolers. And what this graph shows is that a 10% increase in GDP per capita leads to 6% reduction in stunting rates. That's good news. So why don't we just do income growth? GDP per capita poverty reduction should take us there. But it would be nice if the story is that simple, right? What this graph also shows is that income growth can have, without any nutrition lens to it, can have unintended consequences. What this graph shows is that a 10% increase in GDP per capita leads to 7% increase in overweight and obesity among adult females in this case. So really, it is doing both. Perhaps it's increasing, in this case, it is increasing overweight and obesity among adults a little faster than income growth is able to reduce stunting rates. So clearly, a nutrition lens is important in how we do this. And with this recognition, some of the sectors have gained quite a lot of attention in the last, I would say, 7 to 8 years. And these are some of the sectors, and I'm really going to talk about agriculture and food systems in this case. As our understanding of the role of agriculture food systems, especially after the financial crisis in 2006, or food price crisis in 2006 and financial crisis in 2008, the world international community started asking the question, why is it that people are not resilient to shocks, to food prices? What kind of food policies and agriculture policies are needed in order to improve resilience of people to various shocks? And as the understanding of this has grown, so has the international goal-setting agenda, right? In MDG 1, nutrition was just one of the targets, right? It was eradicating poverty and hunger, and it was underweight, which is a very poor indicator of nutrition status. Then we have WHO targets, and with SDG 2, target 2.2, it just gives a mandate for the international community to take agriculture food systems approach along with other sectors in MDGs, to tackle all forms of malnutrition and not just undernutrition. So, but we have to do this in a rapidly changing landscape, right? There is climate change and environmental fragility. There is rapid urbanization, but there is also meanwhile, there is also rapid rural transformation that's happening, right? The rural areas are not static. How information is consumed, their aspirations, etc., are also evolving. There is changing food system governance, production and distribution. Who wields power, say at an international trade agreement, matters in what goes into our mouth. And then the women and men are every day realizing what, they are trying to negotiate their own food acquisition patterns along these shifting grounds. So to me and to us, the two big questions are: how do we make our agriculture food systems sustainable and healthy to all people in this rapidly transforming context? And how do we make nutritious diets physically and economically accessible in an equitable and just way? So the good news in all this is that diets are a modifiable risk factor, right? Food systems affect diets profoundly. So if you look at the global burden of disease latest graphs, what you will see is that several of these risk factors have, several of these conditions have diets as their risk factors. Look at how many of them out there, right? So diets, again, are a modifiable risk factor, but unfortunately they're not modifying in the right direction even in low and middle income countries. If you look at these graphs of how the trend of packaged food and soft drink and processed foods, oils and fats, the trend is really tracking along what high income countries have gone through and are going through. So how do we track this back? How do we make food systems deliver both for undernutrition and overnutrition, because it's not doing either at this point? So there has been an increased momentum to leverage and inform action of the agriculture food systems for nutrition. And three things have happened, I would say, since 2010. By no means is this a new field, but there are new concerns. Having said that, I'm not going to go into the history of this entire field, but I'm going to talk about since the food price and financial price crisis in the late 2000s, and the research that it has catalyzed since, I would say, 2010 onwards. So there is what we know is that agriculture is a fundamental to structural transformation of economies, and it is a very powerful poverty reduction tool, and it is pro-poor, right? We know that from a huge amount of agricultural economics literature and literature on poverty reduction. But pathways to nutrition are not so straightforward. They're interconnected and sometimes often act in opposing directions. So several of us and other institutes have spent quite a lot of time thinking through these conceptual pathways between agriculture and nutrition. And this was developed when I was working in India in the context of South Asia. And as you will see, the stakeholders there have really come up with 6 pathways. And the good news is that regardless of where these pathways were developed by other research groups, we more or less agree on this. There are a lot of similarities. So one is, the first 2 are very straightforward, which is agriculture is a source of food. Of course, it has to then feed people and is important for nutrition. Agriculture is a source of income. In several of these countries that we are talking about, over 60% of the population is dependent on agriculture for their income. Agriculture policy and food prices, the investments government make in the types of research and development, the kind of price stabilization policies they have implications in what foods are available, what foods are accessible to people. And there are several gender dimensions, right? We know that from, again, economics literature, women and men spend income differently. Women, when they have control over their income, then they're more likely to spend it on nutrition production, as economists would call it. So when women do work in the agriculture sector, but the conditions under their work matters profoundly for nutrition because it has impact on their status, it has impact on intra-household resource allocation, women's ability to manage their own childcare, their own nutrition status, and therefore intergenerational transmission of undernutrition. So then several of us thought, okay, well, it's not enough to do some conceptual pathways. We need to put it into some analytical framework, and we came up with, frameworks such as these, and this is a simplified version of that. If you can look at the gender pathways, you can really track, what these pathways are and develop your analytical models around some of these understanding and test if your framework really holds true or not. So what do we know about these pathways? Where is the evidence on this? What we know, the global evidence basically shows that when countries favor agriculture-led economic growth than the other kinds of economic growth, then stunting reduces much steeper, and it has what you see here is doubling per capita income through agriculture led growth is associated with 21% point decline in stunting. That's huge. Having said that, doubling per capita income is also not easy, but I think the gains are huge for declines in stunting. What do we know about the production consumption pathway, i.e. when people produce food, or if there are interventions that help farmers improve their farm productivity and diversity of products produced or foods produced on their farm or in their fisheries or whatever, then what do we know about these interventions? Do they improve nutrition outcomes? What we find is that now we know that these kinds of interventions, yes, improve agriculture production, they improve income, and they do improve diets. Right? There are generally positive impacts or trends on wasting, that is acute malnutrition, and also on anemia. But what we are not seeing from these interventions is that there is no impact on stunting rates, right? So one hypothesis, or several of us believe that that's because these trials tend to be pretty short term, 3 to 4 years, and stunting is quite chronic. And if it was that easy to change, probably we would be in a different, we wouldn't be talking about this by now, right? So that's one. What gives us hope is that the pathways to impact are positively impacted. Sorry, I mean, that's a weird sentence, but at least the direction is along the right, is positive, and therefore there is potential to think that in the long term that these kinds of interventions may have an impact on stunting, even if not in the short term. What we know about women's empowerment is that if there is a magic potion, and I'm not saying this because I'm a woman and I work on these issues, is that the evidence is very, very strong. If there is one magic potion for nutrition, it is empowerment of women. I won't go through all the details, but women's empowerment measured by Women's Empowerment in Agricultural Index or any other index or proxies for empowerment, what we do see is that women's empowerment matters. Women's empowerment especially matters in conditions when the conditions are even more dire or even more challenging, right? So it has a protective effect as well, as we see in case of Nepal. But these agricultural interventions can also improve burdens on women. The lot of critique of these interventions is that women are already burdened, and now because we want women to have more control of income, we are just asking them to do more work with all these interventions. And that is a real concern, right? We don't want women's time to be more burdened with all our interventions. So what we have done is to undertake a systematic literature review. It's a mixed method review from all kinds of disciplines, quantitative, qualitative. And thankfully what we find is that, yes, it does increase the work burden of women, but we actually don't see a consistent negative impact on women's nutrition status or on her children's nutrition status for a variety of reasons on how they draw on various resources around them, which I will not be able to go into now, but you're welcome to, I'm happy to direct you to resources if you're interested. And the third thing that has happened is that there is quite a lot of energy in this field in terms of innovations in evidence generation. The framework and the dialogue and the discourse to date has been very much on, there is this rural farmer who has his farm, and if he only produces 4 different kinds of vegetables instead of just one, wouldn't they be having more diverse diets, right? That is still true for many rural people, but these farmers exist in a larger system. Right? So what we are now doing is moving away just from, or rather adding on just from the subsistence agriculture household model to a more food systems model. Right? And also thinking of the more conventional kind of interventions, for example, of homestead food production to like a more innovative agricultural extension systems that can help improve farmers' productivity with a nutrition lens. And of course, environment and climate change and value chains, there are so many other things that people are now working on and embracing them. And there's been quite a lot of work done in terms of, I've been always wondering where this magic timekeeper is, but anyway, there's been a lot of work in terms of testing and validating this conceptual frameworks, methods, and metrics, because one of the issues we have in terms of studying the impact of food systems on nutrition is the lack of metrics or methodologies sometimes, or at least our lack of knowledge. Maybe there are methods and metrics out there, but we need to discover them and use it for this purpose. In this context is a program that I lead, which is called IMANA, which is all about innovative methods and metrics. And what we do is to purposefully really source grants through RFPs and fellowships to put together interdisciplinary teams to work on some of these cutting edge topics. For example, we are developing a women's empowerment and nutrition index. We are developing low cost surveillance systems using cell phones to track the impact of climate change on nutrition, so on and so forth. The website has more details on all this, and I will not be able to go through this. But one thing I did want to, in the context of this conference and sharing and learning from each other in an interdisciplinary way, is the Agriculture, Nutrition and Health Academy, which is basically a global research network that we have established to bring together interdisciplinary researchers working on agriculture food systems for improved nutrition and health. So this is a variety from different disciplines and both policymakers as well as researchers for research translation to be a part of this academy. And we have several activities that we undertake. The flagship is called the Agriculture Health Academy Week, and we have had 2 so far, one in Addis Ababa and Kathmandu, and before this there were 5 other conferences that were done in London. And as we were funded with Imana, we thought we should really go to the problems we are studying and involve more of the researchers there. So the next one is going to be in June 2018 in Accra, if anyone is interested. And the call for abstracts was out yesterday. And what we do, talking about this mentorship and how to, do some of these events, necessity is the mother of invention sometimes. When we applied for funding, of course, we promised the moon, and then we realized we don't have all these funds for capacity development. So what we had done was, as a back-to-back event to this research conference, we added what we call the learning labs, where since there is a gathering of global experts, professors and researchers in this area, then we thought, why don't we have them and teach like researchers on something. It could be on economic concepts in nutrition, or it could be about how to measure something or develop a tool or use a tool or something like that. And this has been one of our most successful events. So I really think that's something you could look into in terms of how you might want to mentor the young researchers. And so that's what we do. What we also do is convene technical working groups. And the idea of these working groups is to synthesize state-of-the-art concepts, methods, and metrics. So Yes, I'll take 2 more minutes, and then whoever I'm speaking to, yes. And there is a series of working groups that we have. These are constituted of global experts from various fields working on some of these topics. The one thing that I want to focus into is the food environments here, very briefly, is that there has been a lot of call in the food systems literature on improving food environments, right? This is the high-level panel of experts with, I don't know, really high-level people of prime ministers, so on and so forth. And that really talks about food environments and how we should improve food environments in this world, right? What is food and what is a food environment? I mean, they look so different every single day. I don't even know what that guy in the bag will sell tomorrow or what he's selling today, right? How do we understand and track food environments in this low and middle income countries? This is a concept that has been well established, and Steve has been one of the front runners on using this concept and doing this research. It's been motivated very much by obesogenic environments in high income countries with formal food markets. So how do we adapt this concept, very useful concept, to low and middle income countries? So we put together some experts who were kind enough to volunteer their time, and they looked at various definitions, and again they proposed this simple operationalization of this definition of how is it different from food systems, and or is it different from food system? Is it the part of the food system, or is it an outcome of the food system, right? Like, or is it an interface? And they all agreed, oh, probably it's an interface, but we still debate on it. And then really unpack, again, this is building on work that has quite a lot of literature in high income countries, and really adapting some of these and really thinking about how do we conceptualize this for or adapt this for low and middle income countries. And then it was conceptualized as external food environment and personal food environment with various dimensions to it. And we released this as a technical brief, and it has been quite well received. We do receive comments from people every day by our email, whether they agree or disagree. So it's been quite a fruitful experience to bring various people who are working on this to even agree on some things and disagree on others, and agree to disagree on others. So the same thing has happened in the context of sustainable diets, and actually the working group didn't agree on anything, frankly. So instead, what we said is, instead of making them a wanting, it's a very difficult topic. And instead, what we did was develop actually a game. It's a social game to engage key stakeholders to kind of inform their own policies, and that's done, yeah. And for the context that they are in. So that's what is. And my last, can I take 1 more minute? Yeah, okay. Is that these are all cool topics. These are all new. But actually, in nutrition, we are still worried about some conventional nutrition measures, right? For example, how do we measure diets better? How do we improve micronutrient assessments in the field? For example, the way we know whether people are iodine deficient or not is by coverage surveys. Do they eat iodized salt? That's as far as we have in terms of population level understanding of iodine deficiency or lack thereof. So in conclusion, really, we do have convincing evidence on various agriculture nutrition pathways. Low diet quality is a key modifiable risk factor for mortality and morbidity, not just for undernutrition, but also for nutrition-related chronic diseases. So we need to be able to demand more from our agriculture food systems. We are making progress, and we need better tools in our toolbox. And so the intersectoral challenge really is, how do we work more comprehensively to bring all these sectors to bear at the same time, at the same place, on the same population, I would say in this context, if in my context it's mother and child, at the right time. Now that seems like a silly question, but often what happens is the Ministry of Rural Development has a fantastic water program somewhere. Agriculture has a fantastic agriculture program somewhere. But really, often a child is not able to take advantage of a package of interventions. So So that's what the intersectoral challenge and interdisciplinary challenge is. Thank you, and I'm sorry, like I'm a minute over time. Yeah, thank you.